Over the last decade, osmolarity testing has become a standard part of eye care worldwide. Hyperosmolarity is well known to be toxic, damaging the cornea and contributing to refractive instability if left untreated. Measuring osmolarity aids diagnosis, gives you confidence in pre-surgical biometry, and lowers the chance of refractive surprises because no one likes surprises, especially your patients. In a busy practice like yours, adding a new diagnostic tool has to be easy, quick, and efficient for patient flow. Our unparalleled expertise in corneal health led us to develop a solution that streamlines osmolarity testing in your practice. Introducing ScoutPro Osmolarity System. ScoutPro is the first and only portable osmolarity system that is a practical, seamless testing method, delivering the precision eye care providers have come to trust. This is all made possible by the cutting-edge Verilight technology, which allows for collection and analysis in one device, in-office mobility, no docking, and improved efficiency. Based on the experience of over 24 million tests performed and optimized for the next 24 million tests and beyond. Learn about the latest in osmolarity testing technology and how you can seamlessly integrate ScoutPro in your practice today. ScoutPro Osmolarity System by Trucara Medical.
So I'm so excited to work with Trucara, which is a rebranding of TearLab. They're the experts in osmolarity, which is crucial for diagnosing and helping to improve ocular surface health and corneal health. And I really look forward to incorporating the new ScoutPro into my practice. So I work with a great group of physicians at Envision, and our whole model is to provide premium service, premium outcomes with the best technology to our patients. And so that's why I'm so excited to introduce this to and use it along with my Envision co-workers to introduce our patients to the ScoutPro, which is the most advanced technology I think that we can have for pre-operative dry eye evaluation. A lot of us are doing LASIK corneal refractive surgery, and so identifying and properly treating dry eye before surgery is the best way to get happy patients and better outcomes. And so this really provides a guideline for when a patient is ready for surgery so that they can see well and feel well as well.
So most things we do in practice are like corneal staining or tear breakup time, and patients don't understand what those things mean. With osmolarity, it's an objective test. There's a number. It's kind of like the A1C for diabetics. There's a number tied to it, and patients understand they want to get the number perfect. And if the number is bad and hyperosmolar, I can tell them that this is going to impair their ability to have a good outcome. So we can treat them ahead of time, preoperatively, get the ocular surface optimized. And in my practice, we do at least 40% premium IOLs. So it's really critical that we nail this ahead of time. And having an objective test with osmolarity helps me get that optimized as quick as possible. And patients will believe and the expectations set, so they actually will care about treating themselves to get that number normalized. Yeah, so the Epitropoulos study was great because it showed at least 1 in 5 patients were hyperosmolar, and there was great variability, and it actually impaired their keratometry readings. So it gave us inaccurate IOL power calculations. And when you're doing a lot of premium IOLs like I do in my practice, that's a problem. And you don't get a second chance with premium IOLs, and if you don't get the outcome right from the beginning, you have a lot of chair time with patients. So I look at that study to just support why we do osmolarity and minimize the chair time we get post-operatively. First thing, it's portable. How easy this is. It's small, easy. My staff will actually put it in their pocket, can go room to room. You don't have to have it tied to a base anymore. The other thing is it's precise. It only takes about 15 seconds to get the reading and do everything. And it records the readings in the device so we can go back and enter them into the EMR system. So you don't have to rush and enter it right then and there. It'll restore several readings, and you go back and add them all into your EMR system.
I've had the opportunity to work with TearLab back in the day, all the way to now, where it's reinvigorated company called Trucara. I was an early adopter and a believer in doing objective testing in order to make the proper diagnosis and monitor the treatment effects that I was proposing to my patients. Patients loved having numbers that they could follow, and Trucara now, focused on corneal health, we will be able to deliver precise, accurate diagnostics in the arena of corneal health. Even though we know how important tear osmolarity is, there in the past was some pushback about the large real estate that the early TearLab devices occupied, how long it took to get the data. With a new version, the ScoutPro, we can get measurements in 40 seconds for 2 eyes. Moreover, there is no landing spot for this device. It can be kept in the pocket of a technician, therefore easy access to pull out of the pocket, do the test, get the tear osmolarity data in 40 seconds, and move on. Therefore, the pass-through of the patient is not impacted. There's no delay, and there's no real estate that has to be devoted to a large clunky machine. We're so fortunate that we have so many excellent astigmatism correcting and presbyopia correcting IOLs on the market right now. Back in the day, these didn't exist, or for a while we only had an option of 1 or 2. Now actually we have dozens of these incredible implants. As a result, patients are expecting almost unrealistic visual outcomes after cataract surgery. They're paying out of pocket. They understand that maybe some of their friends or family members have achieved incredible vision. However, it all starts with a tear film. After all, it's 2/3 of the refractive power of the eye. So we need to stabilize it. Once the tear film is stable and healthy, or as healthy as we could get it, do the measurements in order to confidently utilize these advanced technology implants, offer them to our patients to improve their quality of life for the rest of their lives.
Over the last decade, osmolarity testing has become a standard part of eye care worldwide. Hyperosmolarity is well known to be toxic, damaging the cornea and contributing to refractive instability if left untreated. Measuring osmolarity aids diagnosis, gives you confidence in pre-surgical biometry, and lowers the chance of refractive surprises, because no one likes surprises, especially your patients. In a busy practice like yours, adding a new diagnostic tool has to be easy, quick, and efficient for patient flow. Our unparalleled expertise in corneal health led us to develop a solution that streamlines osmolarity testing in your practice. Introducing ScoutPro Osmolarity System. ScoutPro is the first and only portable osmolarity system that is a practical, seamless testing method, delivering the precision eye care providers have come to trust. This is all made possible by the cutting-edge Verilight technology, which allows for collection and analysis in one device, in-office mobility, no docking, and improved efficiency. Based on the experience of over 24 million tests performed and optimized for the next 24 million tests and beyond. Learn about the latest in osmolarity testing technology and how you can seamlessly integrate ScoutPro in your practice today. ScoutPro Osmolarity System by Trucara Medical.
So the ScoutPro by TrueCare Medical is really an important tool. I'm excited to have it for my patients as we set expectations with premium IOLs. And that's a big part of my practice. It's really where I'm passionate. I want to be able to provide a premium experience, number one, so having something that doesn't require my technicians to go back to the handpiece in between eyes, but really just approach the patient, treat both eyes, even immediately show the patient what's going on with their tear osmolarity, and then use that information in order to do my planning, to have confidence that I know that if there is a problem, we can treat that prior and get excellent results.
So patient expectations and lab testing are a big part of the pre-cataract workup. I can't tell you how many patients come into our office expecting to be scheduled for cataract surgery, and we have to delay that surgery because they have concomitant dry eye. We make that diagnosis based on topography and lab findings such as osmolarity. And having that accurate diagnosis, rapid diagnosis, helps us pre-treat those patients so when it does come down to their surgery, we have a better outcome. So when you look at the algorithm set out by the ASCRS for pre-surgical management of ocular surface disease, physical exam is critical, but so is diagnostic testing. Having these different touch points with the patients and different diagnostics allows you to properly diagnose and treat the ocular surface prior to cataract surgery. And at this point, I think it's well known that proper management of the ocular surface leads to more happy patients. In our office, we've used Osmolarity for years in helping us diagnose and treat patients with ocular surface disease. And I can't wait to start using the new ScoutPro as it's so much more portable, it's precise, and it's going to allow us to have patients from all different offices to help make the right diagnosis and improve treatment. So if I was to recommend something, or when I'm talking to my friends about point-of-care diagnostics, I've got to recommend the ScoutPro. I mean, being so small, the precision and the importance of osmolarity, this has got to be top line when you're diagnosing and managing ocular surface disease.
We've seen from our market data that the penetration of presbyopia correcting IOLs is increasing. And we also know the importance of the workup in these patients because their expectations are going to be higher. And we certainly can't overlook the importance of the ocular surface. We now know, especially from peer-reviewed studies like the ASCRS Cornea Clinical Committee's publication on the utility and the importance of using various testings in the pre-op assessment of the patient, which was provided by the algorithm, that this is something that you can easily implement into your practice. So in addition to the slit lamp findings of either staining or tear breakup time, we recommend employing a questionnaire that's easily done in your office, and also, if you have access to it, using osmolarity and or MMP9 to assess the asymptomatic patient, because many of these patients don't have symptoms of dry eye, but we know from our publication that 70 to 80% of these patients do have dry eye. This is especially important because we know an abnormal ocular surface confoundingly affects the vision of a patient who has a diffractive presbyopia correcting IOL. That's how these IOLs work. So the ocular surface problems are exacerbated in these patients. So the last thing you want to do is miss this diagnosis, and last thing you want to do is not treat this prior to getting the measurements and doing surgery on these patients.
Over the last decade, osmolarity testing has become a standard part of eye care worldwide. Hyperosmolarity is well known to be toxic, damaging the cornea and contributing to refractive instability if left untreated. Measuring osmolarity aids diagnosis, gives you confidence in pre-surgical biometry, and lowers the chance of refractive surprises, because no one likes surprises, especially your patients. In a busy practice like yours, adding a new diagnostic tool has to be easy, quick, and efficient for patient flow. Our unparalleled expertise in corneal health led us to develop a solution that streamlines osmolarity testing in your practice. Introducing ScoutPro Osmolarity System. ScoutPro is the first and only portable osmolarity system that is a practical, seamless testing method, delivering the precision eye care providers have come to trust. This is all made possible by the cutting-edge Verilight technology, which allows for collection and analysis in one device, in-office mobility, no docking, and improved efficiency. Based on the experience of over 24 million tests performed and optimized for the next 24 million tests and beyond. Learn about the latest in osmolarity testing technology and how you can seamlessly integrate ScoutPro in your practice today. ScoutPro Osmolarity System by Trucara Medical.
It is very important for us as ophthalmic surgeons when we're counseling our pre-surgical patients to talk to them about their ocular surface and their expectations following the surgery. Diagnostic tests that we have available, such as the ScoutPro by Trucara, can help us look at osmolarity as a parameter of the health of the tear film in the ocular surface, which has a very profound effect on what we can expect for our patients post-operatively. It can help us diagnose and monitor our dry eye diagnosis, and also help us monitor the stability of the tear film, which is really crucial for the accuracy of all of our preoperative measurements for cataract and refractive surgery. As we know, an unstable tear film can produce irregularities in the tear film and the accuracy of all of those measurements, which can have a profound effect on our postoperative results. We know that there's significant light scatter that is produced by increased osmolarity. So again, stabilizing the tear film, reducing osmolarity, improving the health of the tear film will provide for us more accurate, more reliable results for our preoperative measurements, a more accurate, on-target result for our patients, and a faster and more comfortable visual recovery following surgery. One of the important things to remember about increased osmolarity is that it's not just a lab test, which is a marker for patients who have dry eye or an unstable tear film. It's been shown, a great study by Dr. Epitropoulos showed us that the light scatter that is produced by increased osmolarity can have a profound effect on our post-operative results. And I think they found that 1 out of 5 patients post-operatively ended up off target if they had preoperative increased osmolarity. So it's important for us to look at this as an important marker of the stability of the tear film to ensure accuracy of all of those measurements preoperatively. And this is especially important in our premium IOL patients, but for any patient, of course, we want to end up on target. So this is an important parameter for us to look at.
I'm excited to work with Trucara, and that's their new name, and it really reflects a commitment toward being a leader in corneal health. And their newest product, ScoutPro, is a reflection of that. So I'm really happy to be working with them and to really communicate to doctors the importance of identifying hyperosmolarity and how that can help your clinical outcomes. The percentage of patients that are receiving premium IOLs really puts the onus on the doctor for predicting who can be good candidates and who aren't. Dry eye and irregular ocular surface can really affect the outcome and the eventual overall patient satisfaction of your surgical patients. Having an objective test that can identify that preoperatively, and then you can set the expectations with the patient. It gives you the opportunity to treat the dry eye and maybe cure the problem, or they may have such severe dry eyes, you might find in, say, a rheumatoid arthritic patient, that they may not be a candidate for certain kinds of lenses because you can't rehabilitate the ocular surface. But the idea of having an objective test to be able to predict who has these issues is very powerful.
We do a lot of testing around cataract surgery. We do surveys for symptoms, and now we're beginning to use the ScoutPro. This has really changed the workflow because it's so much more practical to use this device. The patients get this testing on every cataract patient before the surgery, before the testing, and it really adjusts the workflow of what the next tests are, or if we have to start treating for dry eye or MGD. We want our best outcomes for our patients. We want to use the best technologies and have the best techniques. But a lot of this goes before the surgery, getting the proper testing, getting the proper results. And one of the ways of doing that is treating the ocular surface, or seeing if that ocular surface needs to be treated before the measurements are even being made. We are beginning to start using the ScoutPro to help us determine these things. By seeing if the patients have an hyperosmolar state, we can treat them for dry eye in addition to getting the testing, and then repeat the testing if necessary to see if there's any change. I believe this will improve our outcomes for our patients. It's remarkable how quickly the device works, maybe around 10 seconds per eye. So by 40 seconds, we're pretty much done with this test. In the past, we had to take this to the station. It was much worse of a workflow. We had to come back, do it again. It works well now. It fits in the pocket. One tech can carry it around if necessary. They can hand it off to another. The efficiency of using this device compared to how it worked before is remarkable.
Over the last decade, osmolarity testing has become a standard part of eye care worldwide. Hyperosmolarity is well known to be toxic, damaging the cornea and contributing to refractive instability if left untreated. Measuring osmolarity aids diagnosis, gives you confidence in pre-surgical biometry, and lowers the chance of refractive surprises, because no one likes surprises, especially your patients. In a busy practice like yours, adding a new diagnostic tool has to be easy, quick, and efficient for patient flow. Our unparalleled expertise in corneal health led us to develop a solution that streamlines osmolarity testing in your practice. Introducing ScoutPro Osmolarity System. ScoutPro is the first and only portable osmolarity system that is a practical, seamless testing method, delivering the precision eye care providers have come to trust. This is all made possible by the cutting-edge Verilight technology, which allows for collection and analysis in one device, in-office mobility, no docking, and improved efficiency. Based on the experience of over 24 million tests performed and optimized for the next 24 million tests and beyond. Learn about the latest in osmolarity testing technology and how you can seamlessly integrate ScoutPro in your practice today. ScoutPro Osmolarity System by Trucara Medical.
Dry eye disease is probably the #1 reason why patients are unhappy or dissatisfied after cataract refractive surgery. So I think it's really important that we screen these patients and identify patients that have signs and/or symptoms of dry eye disease. In 2015, we published a paper in JCRS showing that patients with dry eye disease and hyperosmolarity had greater variability in their K readings and IOL power calculations compared to normal osmolar patients. And in the hyperosmolar patients, they had a greater than 1 diopter difference in measured corneal astigmatism. So again, that really emphasizes the importance of really measuring, point of care tests, including tear osmolarity, in these patients coming in for cataract or refractive surgery. Really pay attention to the ocular surface and screen these patients. We're going to really help to reduce the number of refractive misses. And I think that, tear osmolarity is key to that and is part of the ASCRS algorithm in helping to kind of really address these patients that have ocular surface disease. After seeing the results from our study that we published in JCRS, I really feel strongly that measuring tear osmolarity in all our patients coming in for cataract refractive surgery should be standard of care.
In a busy practice, it's hard to get people to work for you, but having a test that you can get very quickly and easily, they like that. I like it because I get the results I want. They like it because it gets them the throughput so much easier. As a busy day as a cataract surgeon, you're going through seeing multiple patients. You need something that's going to let you know you got a little bit of a problem. Most of our premium IOL patients are very demanding. If they don't get the results they want, you're going to be in trouble. With Trucara, they've developed the ScoutPro, and with a really quick little test, you can get osmolarity, which we know if we can control that to the levels we want, we can produce the results that patients require. In our busy practice, we need tests that we can bring to the patients, get the results very quickly. That's what the ScoutPro has done. It's brought this test to us that's easy to do, the patients have no problem, and you can do it in 15 seconds. The results can help with incredible outcomes in cataract surgery. And that's what we're looking for every day in our practice.
I'm delighted that TearLab has morphed into TruCara. I have worked with TearLab for many years. I'm a huge fan of tear osmolarity, and I'm happy that there is a new focus on corneal health, hence the change of name. I have used tear osmolarity as one of the greatest screening tools for pre-op patients for both cataract and laser vision correction. It not only helps me explain the condition to the patient, I can track response to treatment, and it helps me identify the 50% of clinically significant dry eye patients who have no symptoms yet. As we go into the year, there are more and more diagnostics and therapeutics for dry eye, and even cataract surgeons who don't really like addressing dry eye have to do it because their clinical outcomes depend on treating the dry eye. So, this is an important opportunity as we go into 2023 to raise our level of care to astonishing new heights. Today's cataract patient is very different than the cataract patient of 5 years ago. The premium channel IOL patient wants 20/20 vision tomorrow. They want a white eye, a comfortable eye, no optical aberrations, and any tool that we can use to get closer to that goal for them is going to enhance our careers, enlarge our practices. It will lead to fewer IOL exchanges and LASIK touch-ups. So this is a very, very powerful tool in achieving that goal.
I've been lucky enough to be a cataract refractive surgeon now for well over 20 years, and there's no doubt that the expectations in cataract surgery have sometimes been impossible to achieve. Patients want to see better, those undergoing monofocal cataract surgery, but for sure 20-25% of our patients, those that are undergoing premium surgery. So important, the measurements are important, and what we do in taking care of the ocular surface before cataract surgery, during the time of surgery, and post-operatively is so important. So if I take care of the patient well before cataract surgery and their ocular surface, it becomes our problem. If I ignore it and take care of them after the cataract surgery, it becomes my problem. So managing the ocular surface perioperatively is just so important. And tear osmolarity, for sure, is a number that I could live by with the patient and helping follow their course of ocular surface issues. In terms of practice management, a happy surgeon, a happy doctor needs to be surrounded by happy patients, but definitely a happy staff. So I am thrilled with TruCara's entry into this newest iteration called the ScoutPro, which checks for tear osmolarity, in the lane, reproducible, fun to use, and our techs have really enjoyed it. So now when I ask for tear osmolarity, they don't give me a grin, they give me a smile, and they're just happy to do it because the instantaneous results with this device have truly made a difference in our traffic flow in taking care of patients. And now we just don't see the bottleneck in testing that we may have seen before in testing in our patients. As you see in the industry, there's a lot going on with technologies and pharmaceuticals, different therapeutics, different warming devices. The ocular surface is hot. Actually goes beyond dry eye, although dry eye is central. So checking for inflammation, checking for that salt content on the ocular surface is so important. And you've got to keep it mundane where the patient understands what you're talking about before you offer that therapeutic regimen. So having a number that they can take home, remember, follow up with is so important. So using the ScoutPro has really made a difference in checking for tear osmolarity, maintaining that ocular surface, and being commensurate with the times of our demanding patients. Tear osmolarity and testing with ScoutPro it's just so easy. So I get no grief from my staff. They enjoy using it. They like being tech-centric. They love technology, but it's got to be usable and easier to use than an iPhone. So it's really easy to use.
TruCara, formerly TearLab, is a company that I've worked with over the years. Osmolarity testing has been a fundamental daily tenet of my practice, my office protocol. My technicians for well over a decade now know to test tear osmolarity in any patient, whether it's a pre-surgical patient or a non-surgical patient with dry eyes or ocular surface related symptoms. The first thing we do is test tear osmolarity. It's very, very important to how I go about managing patients, diagnosing patients, discussing the disease with patients, and it also impacts what I do to treat the disorder. In the age of the premium cataract surgical practice, which many of us do these days, patients have very high expectations and in some cases expect perfect outcomes. They expect to not wear glasses ever again for anything in some cases. And so identifying ocular surface disease that might have a visual impact, what we call visually significant OSD or visually significant ocular surface disease, VSOSD for short, can affect the refractive outcome of the patient. It can affect how close we get to a plano refraction after surgery or, monovision correction where the patient can be 100% spectacle independent after surgery. And one of the quick and easy ways to detect dry eye disease and the severity of the dry eye disease is with a quick and easy point of care test like the ScoutPro TruCara osmolarity device. With those two numbers, one number from each eye, I can look at those numbers. It takes my technician seconds to achieve the data, and it takes me seconds to analyze the data. If either of the eyes is 308 milliosmoles per liter or higher, to me, that is dry eye until proven otherwise. The higher that number is above 308, the more severe the dry eye is. Now, can there be dry eye and other subtypes of ocular surface disease concurrently? Absolutely, and in many cases, that is the case. Allergy, anterior blepharitis, floppy eyelid syndrome, sometimes subtle corneal dystrophies and things like that can also be playing a role in the visually significant ocular surface disease. But those osmolarity numbers tell me right away whether there's dry eye disease and how severe it is. If neither eye is above 308, let's say, but there is a 8 milliosmol per liter difference between the two eyes, let's say one is 275 and the other is 290. Well, neither is over 308, but to me, that is still a sign of ocular surface dysregulation or a lack of homeostasis, and a sign that there's probably at least mild dry eye disease present when the difference between the two eyes is greater than 8 milliosmoles per liter.